introduction and for highlighting homelessness as it exists in our public library, not just here, but at all of our branches. Definitely we have folks who are experiencing homelessness, struggle with behavioral health issues, are working and homeless, all the things. There are many, like people who are housed, people who are unhoused are human beings with all the things life throws at you, plus they don't have a place to live. But before I start, if you don't mind, this is a small group, so I'd like to know who's in the room. And just you know, you can just say your first name. You don't have to. And anyway, if you want to share what you know, if you're a social worker or whatever. But so and then I'm gonna. But first, I'm gonna introduce myself and a couple other people. I'm Jean Badalamenti. I'm the Health and Human Services Manager for the public library system, not just MLK. And as Robin said, I started in May of 2014. I've never worked anywhere longer, 11 years. It's pretty amazing for me. And it has been great. Lots of challenges, but it's been great. And I want to introduce Renee Hines. Ms. Hines is one of our peer support specialists. And I have not asked Renee to speak, but maybe later she'll say a few things about herself. She's one of the team. And then Lita Davis, who is the newest member of the team. Lita is a social worker, a licensed clinical social worker, and serves in the capacity of our mental health specialist. And we can chat a little, tell you a little bit more about that. And if Lita wants to say things, that would be great too. These are the experts. And Andrea's in the back, and Andrea, I'm not sure of your last name, so. Yeah, and Andrea is a social outreach, are you a social worker? Outreach staff with Pathways to Housing. So I just want to make sure that, and a great partner with us who work here at MLK, and as Robin was talking about, you know, the LOJA and encampment clearing, Pathways outreach team was really instrumental in supporting people really on the ground. So just wanted to. So do you want to start? Do you want to just say hello, introduce yourself if you want? It's totally your choice.
Hi everybody, my name is Aaliyah Kelly, which is HOUGHTON-Kelly. I grew up in Washington, D.C. I was also a former teenager student that attended Martin Luther King's library back in the days, early 1990s. I was here working with the young youth and also was a part of their foundation growing up here. So I'm just coming back and I hope everything turns out great. And also I hope y'all do help with the homeless because it is necessary that the homeless get help with because they have been here for a long time. And also I am supporting them on the movement for them to get in the house because there's a lot of abandoned buildings around DC. So they really need the help. So we is thankful that y'all are supporting and sending people to support those who are supporting the movement with the homeless people, and we're hoping that it could continue and help them get housing as well because it's been over months that these young people, including myself, have been out here with the people to help them get established with housing because the law has passed 2024 that no one should be without housing, and it's a must that they get housing in order for them to move, and it's a order that people get put in a great building. I have rode around DC, Southwest, all through DC, and I've seen a lot of abandoned buildings. Either if we could raise a fundraiser to help them get a building or put in place with the non-for-profits.
And that's exactly the kind of things we're looking for, those ideas. And we'll also, please stay for lunch because we're going to talk about individuals' ideas and we'll write up in a report for you.
Thank you.
included, yes.
We're gonna
Okay.
finish introductions and so we can. Thank you.
My name is Mary Alice Levine, and I am a member of the MLK Library Friends. I'm very interested in this subject, I've seen a lot on the streets. Very hoping we can help.
I'm David Weiner. I'm a member of the Friends. I'm vice president of the Friends.
My name is Debbie Hanrahan. I'm not a member of the Friends. I should be. I'm very concerned about homelessness. I'm very interested in social housing as a way to deal with homelessness. And I don't want a football stadium because we will have no money for the next 10 years to deal with homelessness. So I don't mean to inject politics into this, but it's a matter of money. And we cannot assign all our money to a goddamn football stadium for the next 10 years.
Hi, I am Lisa Wilson. This is my husband, Alex Mallison. We are new residents in Washington, D.C. Or returning residents, but new. And are looking, we bought a home, so thinking about homes and homelessness. My mom lives at Thomas Circle in an independent living facility, and they recently had a lot of complicated issues around homelessness, a camp of homeless people who were right in front of their building. Some of the people in the building were trying to get rid of them, and others were trying to support them, and it ended up being a very messy process. And I would love to hear what ideas are for helping the communities deal with that in a way that is respectful, much more respectful of the homeless people than what I saw happen.
Hello, my name is Jennifer Rickaby. I'm a social worker. I've worked about over 20 years in social work. I've worked with the homeless. I've worked with Child Protective Services. And so I'm always very interested in what people are actually doing, because I realize DC doesn't really have a lot of effective services. And one of my biggest concerns with the homeless is that in the past, I've seen that they have forgotten that quite a few of the homeless are mentally ill. So I think if they could be a focus on that, that would really change and help everything.
Want to go with Great Idea?
Oh, I could.
Oh,
No,
sorry.
no, I think you already introduced me, but again, and I'm Lucia. I'm with Pathways to Housing DC, and I'm the program manager over there.
Good afternoon, good morning, everyone. My name is Kelly Michael Williams. I'm an ANC commissioner. I was also homeless in the city, so I have firsthand experience.
Oh, wait, not me? My name is Jeremiah Montague Jr. I'm very tired. I have had 2 weeks out of hell. I am a former ANC commissioner. I am a member of the Friends of the Woodridge Branch Library. And I'm president of Woodridge Civic Association. So I know firsthand the toll that homelessness and mental illness can take on the library branch. And we have a problem. It takes a toll on the staff as well, how to respond appropriately, which in my particular part of the city can be a challenge.
Sir, do you want to introduce yourself to the next, sir? Green shirt? Yeah. No. Okay. And you in the
Good morning. I'm Anthony Smith with Friends of the Library. I'm born and raised in Washington, D.C. And basically I'm just here to observe, but in my observation as growing up in the city, I've noticed that in terms of the homelessness, is they need more outreach, mental outreach. They need more people to be coming out, find out who needs help, who needs mental help, because a lot of situations arise where, a person is disorderly and then, when the police come, they don't know how to deal with the situation, and they don't know the person has mental illness, and they ends up into a situation where somebody gets hurt, you know, and it could have been avoided if they knew how to approach the person. You know, if they had the training, or if they was already, you know, maybe they already, you know, getting help, they would, you know that when the authorities come, is that they have to calm down or whatever have you. That's just my observation.
Thank you. Quick, introduce yourself and then you'll be the last one.
Oh, well, maybe if he doesn't have the camera right in my face. Please. Well, sure. My name is Juanita Kennedy. I moved to DC in 2008 for work. I worked for the Federal Aviation Administration from 96 to 2020. I had a significant life event in 2018 where I was apparently drugged. I hit like a window at an airport at DCA. I was then in jail overnight. When I came home, something was still wrong. So like CPEP came to the house that I owned at the time, and then with the police officers like interviewed me for a couple of hours. So it's all on video, you know, that's kind of helpful. And then they took me to CPEP, gave me something that I don't know what it was, but I woke up in the psychiatric hospital on the Psychiatric Institute of Washington. I was there for a week over Christmas that year, missing, of course, my daughter was scheduled to fly up for Christmas. Let's see, what else? They released me after a week. The defense attorney came from DC and kind of reminded me to ask for a probable cause hearing, which I did. And before we had the hearing, they just released me. And I walked home from there. I lived on 1st Street Northeast, so I was walking from, if you're familiar with that Psychiatric Institute it's on Wisconsin, but I'm shaking from being nervous or something. I don't know why.
You know what?
Oh,
if you're not if you don't, I just.
Oh no, I think I definitely need to finish talking about it.
Oh.
So what happened then? 2018. So after a few months, I went back to work. You know, the government was shut down in the beginning of 2019. So by the time they had federal employees go back to work, I was out of the office for like a month longer. But then they sort of insisted that I go back to work, and I just would, like 9 to 5, tried to sort of return as normally as possible. But then after about 6 months, I thought, well, I kind of suspected the agency's involvement in what had happened to me before. So part of going back was to figure that out and sort of get a sense of what other people knew and how they behaved toward me and all of that. So I became pretty convinced that they did have something to do with it. And I was kind of trying to send emails to my personal account, like trying to get enough evidence to prove it. And then on one day I felt something was likely to happen in the facility. So I left work at the end of like September in 2019 and didn't go back at all. So
my dear,
initially.
I'm so sorry to interrupt, but we were just doing introductions, and we're going to have some talk at lunch. I hope you can stay for lunch.
Well, I know this is a session about mental health
and about libraries
and homelessness and libraries.
Yes.
So what happened?
Our speaker.
Sure.
And we were just doing introductions. If you
What
don't
happened
mind,
is
Sarah,
the
because
agency
we
had
have-
alleged that I had a mental illness.
Okay.
So then when this drug situation happened to me, and I had never had a history of doing drugs or anything like that, that they
I understand you want to share your
police
story.
seemed to have that information ahead of time. So then the presumption was.
I understand you want to share your story.
So now I'm homeless, and I was evicted in November of 2024.
Yeah. I'm sorry.
And I've been living on the street in tents in the national park area where they've taken the tents twice.
Thank you. I really appreciate your willingness to share
Because
your
I
story.
keep hearing about how all the programs in DC really help the homeless, and as somebody who has visited all of those churches and all of those people who are receiving, well, some are actually not receiving the compensation they need. But I'm telling you, it doesn't actually work to help.
All right.
Thank
you. If you could have a seat and we'll
No,
get
thank
started.
you. I think I'll depart.
Okay. Thanks.
Have a good one.
You
What
too.
was your name?
Jean.
Jean what?
Badalamenti.
Badalamenti?
Yes.
Is that an Italian name?
It sure is.
Thank you.
Hello.
I really would like to talk more about my story. Obviously, it makes me nervous. I considered testifying at the DC budget hearings because there's plenty
Are
of
you
money
gonna-
going out to really help people, and they're not being helped.
Are you gonna be
They're just being sent
here?
through a
Are you gonna be
gauntlet
at
of.
MLK? Because I'll come down in a little
No,
bit.
I'm gonna
and
go
speak
back
with
to the
you.
National Press Club,
Okay,
and I
thank you.
listen to the situation in Gaza.
Thank
And
you.
you know, sometimes people are tied up with like having their basic resources met, instead of being able to help others. We can't even help ourselves here.
Thank you.
And then-
All right.
I think you need to listen to more people who are going through the experience.
So let's just take a minute, pause. Yeah. Come on in.
Am I in this one?
You're in this one, Dr. Crossley.
I'm so sorry.
That's okay, don't worry about it.
For some reason I thought it was 10:50.
Don't worry, because we're running long. So it's great.
I'm so sorry.
That's great. No, it's all good. Okay, so, oh, we're okay. I think she's okay, yeah. Great, so thank you all for coming today and your interest in this topic. I guess the reason I wanted everybody to introduce themselves, because I feel really strongly that the way we solve homelessness is as a community, and we're all responsible for addressing and solving this issue. I think oftentimes we think about homelessness in terms of, well, this person will do it, or this organization will do it, or this, but it is a community problem, and the community needs to participate in solving it. As Robin said, I have been here 11 years, and I have some notes that I'm going to try to stay on topic and not go too long. And I'm just really going to share with you about sort of what's happened over the past 11 years. I was the third social worker hired at an urban public library system. San Francisco and then Richland, South Carolina had a social worker on staff. Following me, the Denver Public Library and now library systems all over the country are hiring social workers from urban, rural, suburban public libraries. So most of which is around, people are hiring social workers to address homelessness in their library systems. But there are also a lot of other needs that social workers and are addressing in public libraries. So it's really a national movement, and I'm trying to get the NASW interested in this as well as something to start talking about, and getting more social workers in public libraries. I also want to first start by saying that we have a program, the Health and Human Services program, that is directly focused on supporting people experiencing homelessness in our libraries. That being said, every single day, every single staff member who works here is, come on in, guys. Hi, Eric.
Hey, how you doing?
Good. Every single staff member,
Sit right here, I'll move.
no, it's all right. I want this young lady to figure out her best situation here. Okay. Every single staff member who works here is supporting people who are experiencing homelessness every single day. They are on the front lines, making sure that people have access, know where they can get services, answering questions, making copies, all the things that anybody would do. Homeless people are asking for in the library, and our library associates, library technicians, librarians, managers are all supporting people, not just the Health and Human Services program. So that's one thing I think is really important to be thinking about when we're thinking about what role the library plays. In fact, I would say library associates are the first responders in the public library because they're answering all kinds of questions. What I want to say about this program to give you a little context and these are very social work terms, but this is the philosophy and the place I think we come from as a team. We are very focused on harm reduction, meaning we're here to help people keep people alive. The library is an institution that I would call a harm reduction institution. It's a place where people can come. They can get the services they need in all kinds of ways, whether it's the bathroom, whether it's the computer, and it reduces the harm that, so just like, the best example I can use is, to understand what harm reduction is needle exchange. So people who are using substances, intravenous drug users, needle exchange provide a way for people to get clean needles. That is harm reduction. What you want to do is keep people alive. And our work at the library is about keeping people alive, whether it's air conditioning, whether it's heat, whether it's working with Health and Human Services staff. We're here to reduce harm for people. We're also very focused on working from a trauma-informed framework, which I'll talk a little bit more about. But it is not something just our Health and Human Services department is focused on, but it is something the entire library system is focused on. And over the past several years, we have been using this book. It's a resource that I helped develop with other social workers around the country who work in public libraries to help us understand how we work with trauma in mind in our spaces when supporting people in our libraries. So that just sort of gives you a sense of sort of the philosophy, where we're coming from. We're always trying to see people's strengths. My team works with people thinking about, okay, well, what is your strength now? How can you be helped? What do you have internally? What resources do you have externally that you can access to help yourself? That's sort of a strength-based model. That's very social worky, but that's where we come from. So there's sort of, I would say, 3 key areas where the Health and Human Services Department is working. And when I came here, it was just me, and I didn't really know what I was going to do, or how I was going to come on in, or how the concept. The reason I was hired back in 2014, there were a couple things happening in the city. The number of people experiencing homelessness had been on the rise for several years. And at that time, and around in 2013, the library had hired about 100 new staff, many of whom were right out of library school, and many of whom had never worked in an urban public library. At MLK in particular, that was a space where people were being dropped off, and homeless individuals were being dropped off every morning and every evening, being picked up and transported to shelters around the city. So we had all these new staff, many, many more people experiencing homelessness, and the library was like, how can we help support people throughout the whole system, staff and the people who are here, and what should we do? The concept was to really build partnerships with other city agencies and other nonprofits. So that was sort of what they were thinking. Fast forward to today, and again, there are sort of 3 areas where we are working. The first is doing some staff training to help staff build their skills, their resiliency around working with people who are the most vulnerable in our city. So over the past several years, We've developed a Homelessness 101 training. Dr. Crossland from Unity Healthcare has supported us in that endeavor. Folks from Friendship Place, Alan Banks, he's not here yet, but he's someone who's also supported that program, along with the Washington Legal Clinic for the Homeless. And really that's a staff workshop where we're helping people understand the context of homelessness in the city, the causes, the solutions, healthcare issues, and their role in working with people experiencing homelessness. We also offer mental health first aid, which is a nationwide training on helping people who are in crisis and understanding mental health issues. We work with a local organization called Defend Yourself on teaching basic basic safety. They developed this program specifically for the public library on sort of assertiveness and boundary setting, all of which is for any customer, but just generally understanding what is annoying versus dangerous behavior, it's taught by social workers and people who have a lot of experience, and about de-escalation for folks. And then just recently we've partnered with the Went Center for Grief and Loss and are providing a workshop for staff on self-care, because the work that people do here at the public library are really frontline workers, and everybody's coming to work with their own stress, and helping people be able to ground themselves at work when there are lots of events and stressors. Even the fact that folks are working with people who are homeless and they can't solve the problem. You know, that's stressful every single day. So we're trying to help get, staff able to ground themselves and be well every single day they come to work at the library. And then I mentioned the trauma-informed, this book, trauma that we're using to help people understand, help our staff do, come on in, staff training. Yes, and I can pass it around. Yeah, here, you can just pass it around. So that's one piece, is the staff training and really getting our staff knowledge, resilience. There's Alan. Hi, Alan. And then we also partner with a lot of organizations, both government and nonprofit organizations. As I said, Dr. Crossland with Unity Healthcare. She is coming to MLK every couple of weeks to chat with people about their physical well-being. And the Department of Behavioral Health is coming to MLK every Tuesday to connect with folks who are struggling with mental health issues. We have a partnership with Neighborhood Legal Services and other legal services programs. So if folks need to address some of their pro bono legal issues, they can talk to a lawyer and get connected that way. We partner with Pathways to Housing on all kinds of things. And those are just a few examples of some of the partnerships. DHS is a partner in all kinds of different ways. And Alan from Friendship Place, who is here, is a partner of ours. So this work is not done supporting people, helping them access services. It's not done in isolation. We're now working with our veterans program on getting some veterans we know here, who are here and at other branches, into housing through a whole citywide surge program. So yeah, again, I think that sort of goes back to the whole idea of it takes a community, both to help someone individually, but how we address the problem more broadly. And then finally, and most importantly, is the work of the We Care team, Renee, Kanisha, we've had several other peers, but Renee is our longest standing peer here. She's been here since the program started. Renee was hired in 2018. I think that's right. So it's great, and Renee has worked with many, many, many individuals who she's helped them find housing every day, is working to connect people with resources. Just a little bit about what peers do. So I'm going to read this off because I think it's really important and critical to the work we've been doing since 2018 with the peer program. Peers are here, first of all, a peer is someone with lived experience. All the peers that we have hired have gone through the Department of Behavioral Health. I can see I'm way over time.
I just want to make sure that our other speakers aren't crowded out. Dr. Crossland, right? You have time, and Maria
2 more minutes?
Foscarini has an appointment. Okay.
Sorry. 2 more minutes.
And we started late, so
Yeah.
boy, everyone is here now.
Ray, hi, how are you?
Good, how are you?
Great. So peers are people with lived experience. They have gone through a training with the Department of Behavioral Health. And then were hired here as contractors and then became full-time employees, I don't know, 4 years ago after the pandemic, during the pandemic. 2019. Okay, great. They provide engagement services, emotional support, navigation and connection to other services, advocacy around housing and getting people into housing, and responding to crises in our buildings. In February of this year, Lita was our first mental health specialist who came on. We got some additional funding from the City Council. Lita is a licensed clinical social worker and is doing therapeutic services, assessment, and referrals to mental health services in the city. And really, the peers and Lita and Kalia, who is not here today, who's the assistant manager and really manages the peer program, also a clinical social worker, are really working in concert to support people both in getting services they need and also helping to manage mental health, folks who are struggling with mental health issues in our public libraries. We've had lots of successes. Lots of people have gotten housed through our program. Many people have been connected through mental health services. Folks have been connected with drug treatment programs. And we're really, as I said, here to keep people alive, support them emotionally, and build trust in a system that is oftentimes they have been kicked out of. The folks who are coming to the library have oftentimes sought services previously, and because the library is so low barrier, this is a place that they can come and sort of rebuild trust with service providers after having struggled at other locations in the city. So I'm going to stop. There's a lot of people here. Thank you for coming.